want to thank you for coming. Can't hear? Can you hear me now? Yes. I see a lot of familiar faces out there today, and I thank you for coming. My name is Dr. Ronda James. I finished my dental degree in California, and in 1988 I returned. Since I've been back, I've served on the Dental Complaints Committee, the Bermuda Dental Board, the Bermuda Dental Association, and the Hospital Staffs Board. When government first proposed health reform several years ago, I was with them 100%. We have an aging population and rising healthcare costs. The objectives they stated at the time were to bring down the cost of healthcare, emphasize prevention, and provide care to individuals who are uninsured. At that time, I, with other healthcare providers, was invited by the chief medical officer at the time to say a few words about dentistry. I spoke about the interconnections between the medical professions, the importance of a team approach, and the different roles we play when helping our patients to get and stay healthy. I was very encouraged by the direction the ministry was going. The reason I'm here today is because the Ministry of Health and the Bermuda Health Council have changed the focus from these important objectives to a single-payer insurance scheme. I do not support this approach because I don't see how changing my insurance policy will improve health care. In fact, I see a greater likelihood of it doing exactly the opposite. I can't help but imagine what the conversation would be if we were back at the same table, working together to make health care better. What a completely different conversation that would be. Instead, we're debating insurance policies and what should be covered. I actually feel bullied by administrators and policymakers. These persons don't treat patients, they don't provide patient care, and they don't see a patient suffer. The upside of this debate is that healthcare providers and the community are coming together to push for the right focus that takes us back to the original keys to reform, lowering costs, emphasizing prevention, and extending care to the uninsured. I see my colleagues across the medical professions coming together. They're demonstrating real passion for what we do, which is to provide health care to our community. As a dentist, I'm concerned with the suggestion that policymakers are making that dentists might opt out of the 2020 plan, meaning that dental care would not be covered by the universal plan that's being drafted. That this is even being suggested tells me that these policymakers and administrators have moved away from the original objectives that got the support of healthcare providers like me in the first place. It tells me they do not know how to bring down the cost of healthcare. And most importantly, it tells me that they don't understand the importance of oral health to one's overall health. Let's focus a minute on oral health care. Oral disease has the highest prevalence in most countries around the globe. More than 90% of all systemic diseases show up in the mouth. I just want to repeat that. 90% of systemic diseases show up in the mouth. There's a direct correlation between oral infections and heart disease, stroke, severity of diabetes, and pancreatic cancer, and that's just to name a few. When infections of the mouth are controlled in the diabetic patient, their test results improve. Think about what that would mean to Bermuda, where we have so many people suffering from diabetes. The point here is that good oral health saves lives and money. It lowers the cost for treating diabetes as well as persons at risk for heart attack and stroke. Tooth loss affects our gut health and our ability to properly digest food, and oral health is critical during pregnancy with regards to premature birth rates. I wish this was part of the conversation we were having. A conversation about how best to serve the healthcare needs of our community. How best to work as a team so that people's needs are met. I don't see how health outcomes will be improved by this single payer scheme. And in fact, I see the opposite happening. I personally know that insurance companies and healthcare professionals are willing to work with the ministry to improve their roles in healthcare. I just don't feel like government's listening. All we're getting from the ministry these days is a push for a single payer scheme. I'm disappointed. The ministry started a conversation that had the potential for making real and positive change for the health of Bermuda. Instead, that conversation has been pushed aside for a scheme that not only doesn't help to make us healthier, but also takes away our choices and carries the potential of limiting access to health care that people may need. Please, ask your MP to take single payer off the table. Please sign the petition. And thank you again.